to today's video, which is going to be a Q&A all about IVF and pregnancy. I asked you guys on Instagram what questions you have for me regarding IVF, pregnancy, even like lifestyle stuff. So I have all of your guys' questions here, and I got quite a few questions, so I'm so happy to answer all of them and very excited to do so. I've never done one of these before, so hopefully we have fun. I'll also address a lot of the frequently asked questions in my DMs, just in case that helps you guys out too. And since I have a lot of new people on here with me and on Instagram, I am gonna do like a little recap summary of my IVF journey, just in case some of you on here have not had a chance to see my IVF vlog. So I did vlog my whole way through my IVF journey, starting from the stim medication all the way through egg retrieval to my frozen embryo transfer and then announcing my pregnancy. So I do have a whole like IVF vlog playlist for those of you who are interested in seeing that, but they are quite lengthy. So if you guys haven't seen them all or are confused about my IVF journey, I'm gonna do like a little recap here first, and then I will start answering your questions. And speaking of, if you're new on here, welcome. I do upload one video a week every Sunday morning, 8 a.m. Pacific Standard Time. And it has either been all about IVF or healthy living or pregnancy updates. Today I am 35 weeks. Can you see the bump? 35 weeks and 3 days. So we are getting towards the end of this pregnancy. I'm getting excited / nervous / I don't know what to think. So I really want to do this Q&A, answer some questions for you before I have this child. And of course, I'm going to bring you on the journey of having my baby too. Okay, guys, so just a little recap on my IVF journey. So right now I am 36 years old. My birthday's in July, just to kind of give you a frame of reference to my age. I started my IVF journey October 31st of 2021. Halloween night marks my first day of stim injections, and I had my egg retrieval surgery at the beginning of November. And my body really responded well to those stim medications. They were able to retrieve 53 eggs from me on the day of my egg retrieval surgery. Of those 53 eggs, I believe 37 were able to be fertilized, either 32 or 37, but then only 8 of those developed into embryos. And I did do the genetic testing on those 8 embryos, and of those 8 embryos, I only got 2 normal ones. And I'll get into this a little bit later on in the video, but that's why I highly recommend that you do the genetic testing, even though it's more expensive. Like, I had to pay thousands of dollars out of pocket for the genetic testing, but yeah, I'll get into that later. But yeah, only 2 normal embryos out of 53 eggs, which is kind of mind-blowing. So even though I was really happy with those 2 embryos, I decided to do a second cycle of egg retrieval because I was thinking, okay, what if one transfer failed and then I only have 1 embryo left? Or what if both transfers fails and I have no embryos left? 2 wasn't really satisfactory for me. I wanted at least 3. So I did decide to do a second round of egg retrieval. So I started the stim medications again February 13th of 2022. And that's kind of a reason why this video is kind of special to me, because I started my second round of egg retrieval exactly a year ago today. And it's crazy that I'm 35 weeks pregnant, and like I would never have guessed that I'm so far along being pregnant. And I feel like I just did my second egg retrieval, which I kind of did. A lot happens in a year, you guys. It's crazy. So I started my second round of egg retrieval February 13th, 2022, and had my surgery at the end of February. That surgery was a little bit less dramatic. They got 17 eggs from me. I believe 9 were fertilized, 4 turned into embryos, and after the genetic testing, I only got 1 normal embryo. But you know, that was good enough for me. I got 3 normal embryos, and I was reassured because I knew that these 3 embryos were normal. They've been genetically tested, and their quality was like, I can't remember the grade, you guys. I'm so bad. I need to like call my fertility clinic and like find out the grade of my other 2 embryos. I know that this one was like excellent, whatever excellent is, like grade A. I'm not actually too sure about the grade, but I know it was excellent. My initial plan was to do my frozen embryo transfer pretty quickly after February, but I started a new job. I quit my ICU job because it was too much stress with COVID and being an open heart recovery nurse. I loved it until COVID hit, and it was just so stressful. And I knew stress and going through IVF was not a very good combination. So I quit my bedside ICU job last March, and I got a pretty low stress job working in the OR, outpatient surgery, orthopedics. So I'm very happy I did that because my stress level went from here all the way down to here. Even though I started a new job and like it's a different field of work, the stress is so much less. So I think that really helped my frozen embryo transfer be successful because I was way less stressed. Anyways, I wanted to get used to my new job first before I did the transfer. And so I did not do my frozen embryo transfer until July 1st. So I went from the end of February all the way to July 1st without doing any IVF. But I really valued that time not doing IVF because I got myself healthy. I was able to get myself strong and healthy again. And yeah, just getting into like an exercise routine and a healthy routine again was, I think, another key in helping my body accept the embryo. But this is just me like thinking back on my journey. But I really do think the rest between February and July of not doing any IVF treatments was really good for my body. So then I had my frozen embryo transfer at July 1st. Yeah, and the rest is history. It was a success. I still can't believe it, honestly. I probably won't believe this whole thing entirely until I'm holding my son in my arms because it's just a lot. I never thought I would have kids. I viewed IVF as a last-ditch effort, and lo and behold, it worked. All right, guys, so let's get into your questions. I honestly have not had time to look at them, so we'll just kind of do this off the fly, which is totally fine. Okay, first question, how have you been able to keep your weight down? Without fasting, I'm not sure how to manage. Okay, so this question is so individual. Everybody is so different on how they react to the IVF medications. I know that I suffered from quite a bit of bloating, not so much after the first egg retrieval surgery, but the second egg retrieval surgery. I did do a video on how I lost all that water weight pretty quickly, so I can link that video down below. But yeah, I gained over 10 pounds in water weight, lots of bloating, and honestly, you can't really control how your body reacts to the IVF medications. You just have to drink lots of water, keep eating as healthy as you can, keep your body moving, lots of walking, and it will eventually subside. But some other people have asked me this question with pregnancy. Again, you just do your best with eating healthy as you can. Honestly, this pregnancy, I'm not eating healthy. I just crave all the sweets in the world. As you guys know who follow me on Instagram, it's really hard to eat healthy during this pregnancy, even though pre-pregnancy I was like super healthy eater. But you just do your best on a daily basis. You try to live as healthy as you can every day, and whatever your body's gonna do, it's gonna do. But you really can't control a lot of things that your body is going to do, especially during IVF and during pregnancy. So you just live as healthy as you can every day. But you also want to have like a balanced lifestyle too, and like have your mental health be okay. So I mean, if you want a piece of chocolate, eat the chocolate. If, like, you know me, I'm eating Snickers now and like all this junk food, and it's like, Brittany, it's okay. It's just a phase in your life. And that's the other thing I have to keep reminding myself is IVF and pregnancy is such a little phase in your life. It goes by so fast. You know, after your IVF treatments, get yourself healthy again, or after you have the baby, get yourself healthy again. It's just little phases in your life that you just have to kind of embrace and make the most of them. So I guess that's my answer to that question. Okay, next question. How does cycles work? Also, could IVF be worked out through a payment plan? So cycles, I'd have to kind of start from the very beginning. I just recommend that you talk with your fertility clinic and get educated on how the cycles work and what you're looking at in terms of timeline. But to answer the second part of the question is, could IVF be worked out through a payment plan? Every fertility clinic is different, but I know that most fertility clinics do have payment plans. I know that mine has a payment plan, but the interest rate's really high, so I did not go with that payment plan. Actually, I did do a whole video on how to pay for IVF if you don't have insurance to cover it. My insurance didn't cover any of IVF at all whatsoever. So I was out of pocket for all of it, which came down to close to $50,000. So I'll link that video down below on how I paid for IVF out of pocket and how there's different ways you can pay for IVF out of pocket if you don't have insurance. So I'll link that video down below because I went into full detail on how to do that. But yeah, ask your fertility clinic because they should have a payment plan, and hopefully they don't tack on a bunch of interest to it. Okay, next question. What are the most helpful pelvic floor exercises? Yeah, so I just did a video on this a couple weeks ago. I will also link that video down below on the pelvic floor exercises I've been doing to help strengthen my pelvic floor, get it ready for labor and postpartum recovery. But the key exercise to do to help your pelvic floor for labor and postpartum are to do Kegels. And so in that video, I go over like how to properly do a Kegel. And so I'll also link that video down below and make sure you check that out if you're interested. But yeah, doing a Kegel, that's the most important exercise to do to strengthen your pelvic floor. Okay, next one. Thoughts on gender selection, exclamation mark. Okay, so a lot of you know, I did not want to know the genders of my embryos. I don't know the other two embryos' gender right now. I should probably find out because Josh really wants a daughter in the future. But I'm still kind of wondering whether I should find out the genders of my other embryos. But I did not want to know the gender of the embryo when they transferred this embryo in me. I just didn't want my heart to get too attached to the embryo just in case it failed. It would just be like another layer of like mourning or loss for me to go through if I knew the gender of the embryo being implanted in me. I just told the embryologist, pick whichever embryo looks the best, like the most excellent grade, and that's the one I want transferred in me. And of course, it happens to be a boy. But I did not find out the gender until about 20 weeks. And that was really when I felt ready to know the gender. Especially when that 20-week ultrasound happened, it really confirmed in my mind that, okay, baby looks good. There's actually a baby in there. And I was mentally and emotionally somewhat ready. I haven't been entirely ready emotionally during this pregnancy, but I was ready enough emotionally to find out the gender at that point. But everybody is different on this. I think most people find out the genders of their embryos right away. But if you don't want to know the gender of your embryos and you do meet with your doctor or embryologist, make sure you tell them like right up front, right away that you don't want to know the genders, because they will tell you pretty quickly. So I'm glad I said, oh, I don't want to know the genders, like, because we did meet with the embryologist a couple times just to go over like the embryos and the grades and stuff like that. And I was like, don't tell me the genders. And she was like, okay, I'm glad you clarified that, because I would have put that on the screen because we did a Zoom meeting a couple times with the embryologist. So yeah, just make sure if you don't want to know the genders of your embryos, you say that like first off if you're meeting with your embryologist or doctor. But yeah, that's why I didn't find out the genders of my embryos, because I needed to protect my heart, and I know myself that I would get more attached to the embryo if I knew the gender. Okay, next question. How did you manage the 9 days before they did your pregnancy test? Okay, so this was one of the hardest parts about IVF for me, was the day after my transfer and then waiting that 10 to 11 days I had to wait for my pregnancy test. That was really difficult. I just kept myself busy. So I did a video on how I took care of myself post frozen embryo transfer, which I'll link that video down below. And I went into full detail on how I survived those, I think it was 11 days I waited, because I had my embryo transfer July 1st and then I found out my pregnancy results July 11th. And so I did a few things to survive that waiting period, and I went over all that in that video. But the main thing I did was I just stayed busy. I went on with my normal life. I didn't do any workouts because I wanted to give my body a chance to rest and like embrace the embryo, but I still got my 10,000 steps a day. I have a Vishla, as you guys know, who has a ton of energy and needs his walks every day. I'm a landlord, and so a couple of our tenants happened to move out that weekend of my embryo transfer. So the day after my embryo transfer, I was washing baseboards and scrubbing walls, of course, taking breaks and listening to my body. But I did not rest. I stayed active. I tried to occupy my mind with other things so I wasn't consumed with like, am I pregnant, am I not? And because it's a total mind game after you have your embryo transfer, because it's like, oh, you're just wondering the entire time. So my advice and what helped me was to stay busy. I was outside, did my walks. Like, I did a lot of things that I liked to do to keep my mind off of that. And by the way, bed rest is normally not recommended. I have gotten a couple DMs from people saying that their doctor recommended bed rest. You have to go with whatever your doctor is telling you to do. My doctor highly discouraged it. She's like, there's no reason why you need to be on bed rest. It might even make the outcome worse, because then your mind is going to be wandering, and mental health and body connection is a real thing. She wanted to make sure that I was busy. So that's how I handled it in a nutshell, but check out that video if you want more details. Okay, next question. What was the hardest part of IVF for you and why? So honestly, the hardest part of IVF for me were those progesterone injections, those IM progesterone injections. Oh my gosh, you guys. I shed a lot of tears giving those to myself, and I had to give them to myself. My husband is so queasy around needles. He faints when he gets his flu shot. My whole IVF journey, I couldn't rely on him at all for the injections. I gave all of them to myself, but those PIO progesterone injections were horrible for me. And that's why I did a whole video on tips and tricks on how to make those less painful. So if you guys are going through progesterone injections or you're about to go through them, check out that video if you haven't yet, because I did find out a lot of tips for myself that really helped decrease the pain on those. Giving those progesterone injections in my butt to myself every single night for 13 weeks was excruciating. It got easier and easier, and towards the end it was easier, but it never was easy at all. And I remember the first probably 6 weeks of those, I was just limping around. My butt was so sore. I could barely like do a squat. They were very painful for me. And at the same time, it was my first trimester. So they had me start these progesterone injections 6 days before my frozen embryo transfer. And then if I did get pregnant, which obviously I did, I'd have to continue them for the next 12 weeks, the whole first trimester. So not only did I feel bad, I was nauseated. My mental health was like borderline, because I was like, is this really happening? Like, they say I'm pregnant, but like I can't believe it, but I'm nauseated. And on top of that, I'm freaking sore from these injections, and I had to like think positively or try to think positively before giving them to myself, because I would dread them every night. So it was just, that was literally the hardest part of IVF for me. Probably the second hardest part was that waiting period after the frozen embryo transfer, and then finding out I was pregnant. That's probably the second hardest part of IVF, but it's all pretty difficult, unfortunately. But now looking back on it, the stim medications and the egg retrieval surgery was the easiest part. Okay, so this next question is kind of stemming off the previous question. At your lowest mentally during IVF, what did that look like? I think it was those progesterone and oil injections were at my lowest mentally, because those were hard to handle. Plus, like, I couldn't let myself believe the pregnancy yet, just in case it still failed. There was a lot going on mentally and physically. And what did that look like for me? Honestly, I just tried to let myself feel everything. I had a couple cry sessions, which is very therapeutic. Luckily, I have a very supportive husband, so I would cry on his shoulder. I would call my family. My family was very supportive. So just surrounding myself with supportive people really helped. But yeah, there was quite a few crying meltdowns. I think that's pretty normal and typical, but just letting myself feel the emotions, I think, is a good therapy to have. If you just, well, for me at least, if I just kind of kept it all in, I would burst out eventually. So just really communicating my thoughts and feelings to Josh especially, and then calling my family. But there were quite a few crying sessions, not gonna lie, but it did get better after those injections ended. And then I got into my second trimester. I was able to believe the pregnancy more. And once my 20-week ultrasound hit, I was like, okay, I'm a much better place mentally. I never got like super depressed or super anxious, but yeah, it was hard. It was difficult, not gonna lie. And I tried to share a lot of that on social media so you guys have somebody to relate to. Okay, couple pregnancy questions. Do you still lift patients at work? I'm 9 weeks, and I do if the patient is not too heavy. I lift with another person. Yeah, I lift patients. I work in the OR now, so there's not a whole lot of lifting, but when I was at the bedside last year, I would work with a couple pregnant people, and they would still lift patients. But I do, and you guys see my workouts on Instagram, like I lift heavy weights still, like I'm careful, but there really is not any research to back up lifting patients, lifting heavy things is gonna cause you harm, unless like you're really like straining and you're popping out like me. You really, like in my phase, I really had to be careful with like engaging my abs and breathing, because I could really injure myself with being this big now. But at 9 weeks, you're not showing yet. There really isn't a whole lot of concern with lifting things yet. Of course, like I said, when you're heavy and big, you worry about ab separation and pelvic floor. So you do want to be careful lifting patients. But even at 35 weeks, I still do my workouts. I still lift 20-pound weights. Like I do still lift patients at work, like transferring them with help. But you just want to keep track of how you're feeling, of course, and keep track of any aches and pains you have. But yeah, I wouldn't be too worried about like not lifting anything. That's not really necessary either. Definitely go on with your work day. Just keep track of how you're feeling. Keep track of good body mechanics, because us nurses tend to rush. We're never on time with anything because they cram so much into our workload. I wouldn't worry too much about like restricting your activity being pregnant. I would just really listen to your body and just be smart about it. Okay, did you have cramps throughout your pregnancy, and what are your consistent symptoms even now? So I haven't really had any cramps during pregnancy. I'm experiencing some Braxton Hicks contractions right now, it feels a lot like cramping. Basically what it feels like some tightening in my lower abdomen and a little bit of like period cramping at the same time. That lasts like 30 seconds and then goes away, and it's been pretty pretty mild to the point where like I notice it, but I don't have to like stop and like heavy breathe or anything. That's the only cramping I've experienced. I didn't experience any cramping right after my frozen embryo transfer. I didn't have any symptoms, as I made a whole video on this. Didn't have any symptoms at all after my frozen embryo transfer until I got my pregnancy test. I didn't have any symptoms, no cramping, no bleeding, nothing. And even after that, like my first trimester, besides nausea, I didn't really have any symptoms. And then my consistent symptoms even now, probably the most consistent symptom has been nausea at night. I'm not nauseous per se anymore at night. I just don't have a great appetite at night still. And my nausea has always been at night, not really in the morning, which I'd rather have it at night than in the morning, so then at least I can function during the day. But yeah, just the low appetite at night, some nausea at night still has been consistent throughout the pregnancy. Another question, do you remember how long it took for the financial coordinator to get back to you? It's been over a week. So I'm lucky and my fertility clinic is on top of things when it comes to the financial part of it. During my first IVF consult, they went over all the finances. And so at that time, I was able to set up my financial plan with them. And so it was all done in like one fell swoop. So I think every clinic is different. If you haven't heard from your clinic in over a week, I think you should probably reach out to them and call them because they're probably not aware of something and unfortunately these clinics are super busy, so you might have gotten lost in the shuffle. So I would definitely call them and follow up. Okay, next one. Did you have a SCH? It's common with IVF. I don't know what an SCH is. Let me look this up. It stands for subchorionic hematoma, is common in early pregnancy achieved by in vitro fertilization, embryo transfer / frozen embryo transfer, and associated with adverse obstetric outcomes. However, there are no methods known to accurately predict the occurrence of SCH. Okay, I don't think I can answer this question because I need to look this up further. I'm not really understanding what it is. If you're watching this and you ask me that question, DM me because I will research it and I will get back to you. Or maybe one of you know what it is, you can comment down below and explain it because I don't really know much about that. Okay, next one. Did you cut carbohydrates and dairy before your FET or went vegetarian? ? Thanks. No, I didn't do anything special before my frozen embryo transfer. I actually went and had a drink at the bar the night before my frozen embryo transfer because I felt like that was my last chance to drink. I'm actually glad I did that because it's been since then since I've had a drink of alcohol, and I'm not like I'm an alcoholic or anything, as you guys know. But I do like my glass of wine here and there, especially at night when I cook, as you guys know. I do like my cocktails, and I'm like, you know what? This is my last chance to have my favorite cocktail, which is a Maker's Mark Manhattan, and that's what I had the night before. I didn't follow any particular diet. I just really tried to eat the fertility-friendly foods, the fertility-boosting foods, high in antioxidants, the foods that are high in omega-3s and, you know, fiber and gut-healthy foods, stuff like that. So I really tried to eat a lot of fertility-boosting foods that I always talk about on here and on Instagram. But besides that, I didn't follow any special diet. I was already cutting out dairy for the most part before because my skin breaks out a lot with dairy. So I was already pretty much dairy free, and I was already pretty much gluten free because normally I follow like a lower carb diet. I feel better on a lower carb diet normally. That's why this pregnancy is so weird because give me all the carbs. But yeah, I didn't follow anything in particular. I just really wanted to eat healthy, eat all of the foods that help with fertility, and that's kind of what I stuck with. That day of my embryo transfer though, that night I wanted salmon because of the omega-3s and the protein, just to like help my body, give my body the best chance to absorb that embryo. Okay, another question. IVF has given me body image issues. Ever struggled with this? Tips for coping? Yes. I talked about this in one of my vlogs. I believe it was my second week of IVF, my egg retrieval vlog, because I gained over 10 pounds of water weight, which for me being baseline at 130, 132 pounds is a lot of extra weight. And it does mess with your mind because you're going through all these treatments ultimately to get pregnant in the future, but you're not pregnant yet. And so it's like, okay, it would be better if you were just pregnant and gaining weight. It's like, okay, it's a beautiful thing, right? But you're going through these treatments and gaining weight, and it's like, but I'm not even pregnant yet. Yeah, it really messes with your mental health, I think, and body image. I think that having body image issues during IVF is completely normal because these medications they're very hard on your body, and they do make you gain weight. They do make you gain water weight. Just remember that most of the weight gain that you gain during a couple of weeks is just water weight because it's pretty impossible to gain a lot of fat in a couple of weeks. It takes a longer period of time to gain fat, but water weight can stack on quickly within hours actually. I actually did a reel on this too, I think last year, on like how I coped with my body image issues, because I did have body image issues after my second egg retrieval surgery. I think just reminding yourself that this is a very short period of time. Again, it's a short phase in your life. It's gonna pass. Your body is gonna get rid of that extra fluid, and if you did gain some fat, it's gonna get rid of that fat. And if it doesn't, well, who cares? Just be proud of the fact that you've gone through IVF, that you conquered. Most people are not strong enough to go through those injections and to go through IVF, so just give yourself props that you did it. And yeah, just keep giving yourself grace and be proud of yourself. So that looks like that's the majority of the questions, but I did want to address the whole genetic testing of the embryos issue. I have gotten quite a few DMs asking me why I did genetic testing on my embryos, what made me do the genetic testing. So just to back up, and I kind of gave this example earlier with all the embryos I got during my first egg retrieval. So I got 8 embryos, only 2 of those were normal, genetically normal. And just to kind of give you an idea, so though out of those 8 embryos, 2 had Down syndrome, I believe, 1 had Turner syndrome. Both of those, Turner syndrome and Down syndrome, basically is a chromosomal defect, or one of the diseases, like is missing a chromosome or whatever. Those 3 had those 2 diseases. Then I had a couple mosaic ones, which could be a successful transfer, or they really couldn't guarantee that mosaic embryos would be a successful transfer that would develop into a normal baby. But all in all, out of the 8 developed embryos, only 2 were normal. And so I'm so glad I got the genetic testing done, because I can't imagine like just blindly transferring one of them in me, and it could have been the Down syndrome one, it could have been the Turner syndrome one, and most likely the body would have just discarded it because it would have recognized that disease. And that's why the #1 reason for miscarriage and for a failed transfer is an abnormal embryo. And you're not going to know if your embryos are normal or abnormal without doing the genetic testing. And I know the genetic testing is thousands of more dollars, but I think it's worth it when you have way more of a guarantee of a successful transfer if you do the genetic testing. But of course, there's a lot of factors involved. Like me being on the older side, I definitely want to do the genetic testing. But if you're younger, like you're 30 or below, maybe it's not that necessary to do the genetic testing because your egg quality is better. So then your embryos might be a little bit more normal than mine. I don't know. Overall, I highly recommend doing the genetic testing, having peace of mind that your embryos are normal and healthy. Okay, this video is now getting kind of long, so I'm gonna cut it off here. If you guys have any more questions, I know I asked my Instagram people for any questions that they have regarding like IVF and pregnancy, but if you guys on YouTube with me have any questions, please comment down below and I will definitely answer all of them. I'm very passionate about IVF, obviously, and pregnancy, and going through an IVF pregnancy specifically. So if you have any questions I haven't answered yet, comment down below and I will definitely answer them for you. Thank you so much for coming on here and watching. I hope this video helped you out. Those of you going through your own IVF journey, your own infertility journey, your own IVF pregnancy, or dealing with any loss, whatever you're going through that's super difficult right now, don't give up. Hang in there. Stay on the horse, even though it seems like you're gonna fall off at any moment. Just hang in there. Like I've said so many times before, I never thought I would be having a child, and I just cannot believe I could have this baby any minute, which is crazy, mind-boggling to me, and that I started my second round of egg retrieval exactly a year ago. You just never know, you guys. And as promised, I'm finally ready to do a what's in my hospital bag, so that will be the next video. Give this video a thumbs up if you liked it, because it does really help support my channel. I will see you in the next video of find out what's in my hospital bag. I'm kind of winging it. I don't really know what to pack, but I think I got the gist of it. So I hope you guys enjoy that video next week. Make sure you take care of yourselves and always remember to be kind to yourself.